So very much. Congress coming back to work in just a couple of weeks now, but during the August break, a lot of members have been getting an earful on the issue of health care reform. Joining us now, Representative Connolly of Virginia, who just sponsored a health care forum for Northern Virginia's senior citizens. Before we talk about that, though, we've spent so much time in the last 24 hours talking about the passing of Senator Kennedy, and I know he's been instrumental to Congress, not just in the area of health care, but in so many other ways. Your memories or anything you would like to say?
You know, my memories actually of Senator Kennedy go way back. I come from Boston. My father was a delegate to the State Democratic Convention in 1962 that nominated Teddy Kennedy to the United States Senate. And I remember him being our speaker at our high school communion breakfast. And then, of course, I moved here and I worked in the U.S. Senate, so I had the opportunity and privilege to work with Teddy Kennedy on a lot of issues. He truly was a lion of the Senate, but he was somebody willing to compromise. And despite a fierce partisan and liberal reputation, the fact of the matter is he understood that legislating was the art of compromise, and he worked well across the aisle and had lots of friends across the aisle. That's how things ought to work in Congress.
When you go back to those early days when you had that the breakfast and things like that, did you have a feeling then that this is somebody who obviously, he probably had presidential aspirations at some point, even then that he may have known, but did you expect that this is somebody who 47 years later would still be making this kind of an impact here in the Senate?
I don't think so. He hunkered down finally after he sated his presidential ambitions in 1980 and became a legislator. And I think once he came to grips with that and decided that's who and what he was going to be, unlike his two brothers who preceded him, who had burning political presidential ambitions, I think it made him the success he became.
A lot of people now saying, what can we take from this now and hope that Congress will retain or perhaps learn from? A lot of that in the bipartisan spirit, the understanding of how things work. Do you think we'll see any changes now in congressional behavior because of this, or will we learn anything from what he has left behind through his decades of service?
I hope so. I think there's a great fondness for those who knew Teddy Kennedy, especially in the Senate and the other body. But this debate is going to be a fierce and passionate one. Clearly, it was a legacy he wanted to see achieved, and he just fell short of it in his lifetime. And I think it's probably going to renew the dedication on the Democratic side of the aisle to try to get health care reform passed.
And let's talk more about that, not just what's happening in Congress, where you guys are supposed to be on vacation right now, but this issue seems to be overshadowing most of that. Obviously going to be much spirited discussion as a body in a couple of weeks when Congress reconvenes, but you're out there and about like so many of your colleagues in the community as well. You had a town hall meeting of your own earlier this week with a slight twist. This one didn't seem to have the theatrics perhaps that some of the others had. First of all, how did you accomplish that? And second, what did you learn that you can now pass along to your colleagues in Congress?
We had a very civil and respectful town meeting. It was very vigorous, very lively. Folks passionate on both sides of the issue of the need for health care reform. But I think that what I learned was that if people are willing to listen to each other, and if we're all willing to respect each other's concerns, fears, anxieties, beliefs, we can actually get somewhere. I think by the end of that town meeting that I held, I think some minds were changed about, reassurances given about the need for a certain basket of reforms that has to occur in the United States. I think there was broad acceptance of the fact that the current system on the current cost trajectory is simply not sustainable. Something has to happen.
It's such a complex issue across the board because everybody seems to be affected in a different way. Was there any single particular issue that seemed to rise to the forefront from the folks who were at the meeting?
I think the biggest issue with my constituents in that town meeting, which was primarily focused on the senior population, obviously was anxiety about will Medicare be there for me? Are there going to be some changes in Medicare? Will some bureaucrat decide on the quality of coverage or what coverage I get? And I think we went a long way, I hope, to providing some reassurances in that regard.
All right, quickly, before we let you go, I want to talk about some of the other things that are going on in Virginia. Yesterday, we had gubernatorial candidate Creed Deeds on talking about transportation. I know that's a hot-button issue with yourself. Just bring us up to speed now on what you're looking at for transportation needs in Virginia.
Well, especially in Northern Virginia, we've got a multi-billion-dollar deficit in transportation investment. The state is, has cut way back in transportation in the last couple of years. It's bordering on the catastrophic, frankly, because we're going to run out of matching dollars for federal highway funds. So something has to happen in Richmond. We need gubernatorial leadership. I support Creed Deeds. I think he's willing to do the hard things. I frankly think his opponent does not.
All right, we're going to have to leave it there. Unfortunately, Congressman Jerry Connolly,
Thank you,
thanks.
Steve.
Always a pleasure to see you. Good luck with that health care battle.
Thanks very much.
When you guys
Great seeing you.
reconvene, we'll talk to you again then.